or contact WKBW-TV at 7 Broadcast Plaza, Buffalo, New York 14202. Call 716-845-6100.
If you see news happening, call the Eyewitness News tip line, 840-7777.
That's all it takes to bring your world together.
All right, everybody, we're back. It's 12 minutes past 10 and 13 degrees outside. And what you're looking at right now is of paramount importance if you or someone you know has been diagnosed with coronary artery disease. Now, there is a non-surgical treatment option that has been very successful. It's called Enhanced External Counterpulsation, or EECP, and it basically helps increase the flow of blood to your heart. Here to tell us more is Aaron Hirsch, who's the president and CEO of VascuFlo. Good morning, Aaron. How are you?
Good morning. Thank you.
You looked into this in caring for your dad. He has coronary artery disease.
Correct.
How did you find this therapy?
Well, it's quite a long story, but I'll make it short. He had a massive heart attack in 1994, bypass surgery, stenting, all the normal invasive options. Those didn't work for him for some reason. His anatomy didn't take well to those.
Wow.
So he went to the Cleveland Clinic in 1995 after a year of being pretty complacent and sitting around the house with constant chest pain. It was there that they said, you know, you are definitely not a candidate for any more invasive procedures. And they said there is an option that just became approved in 1995 by the FDA called external counterpulsation. The problem was it's a 35-course treatment, so it's quite a commitment. But he was willing to do that, and he went to Rochester from Buffalo daily for the 7-week treatment. And it was after the second week where he was calling me and telling me how wonderful he felt.
Wow.
And it was then that I'm a pharmacist and I have a medical background, and I just wanted to see what was making him feel so well. Went with him and just for about a year did research on the therapy and found some doctors interested in bringing it to Buffalo.
And you have.
Right.
And that's the great news for those who are watching today. That's great.
We brought it in 2001 we opened, and just expanded ever since. As the demand keeps increasing, the doctors become more aware.
That's great. All right, now we're showing video, and here's actually how it works. These cuffs are applied to your larger limbs, and these cuffs, with some pressure, force the blood through the heart?
Actually, not through the heart. The cuffs squeeze sequentially from the calves to the thighs through the waist, forcing the blood back through the coronary arteries. So not into the heart. And what this does is it causes your body to release neurohormonal substances that they now, from evidence-based, see that it causes angiogenesis, which this means the growth of new vessels around blocked arteries. So in other words, it's coined a natural bypass.
So, and I've heard of that if blood cannot get to the heart in a normal way, it will find a way.
Exactly.
In many cases.
Your body will do this on its own with exercise and proper diet. Unfortunately, the patients that come to us are usually unable to exercise because they have such severe disease, and so we can do this for them.
Wow. Is this something that your doctor or your heart doctor will prescribe for you to try this therapy?
Usually, if the patient has exhausted all invasive options, most of the physicians, we're trying to do a good job of educating the physicians in Western New York of using EECP therapy as a line of treatment.
That's great. Now, Aaron, we're happy to say your dad is doing very well to this day.
He's doing great.
Now, after his course of treatment, does he need any more?
You can have more treatment. He has repeated the treatment 2 more times over the last 10 years, and it's more or less as a preventative maintenance type therapy.
Wow.
He really is asymptomatic, meaning no symptoms, but we kind of just want to, he's got the benefit of me owning the site, so as a preventative measure, we do put him through every couple of years.
Will doctors normally prescribe this for people who can't take any more invasive procedures, or would this be the first thing that they would try before they do that?
Well, it depends. There are some doctors that will send a patient to this first if the patient is unwilling to go through maybe a second or third bypass or a second or third stenting procedure. But normally the doctor will try the invasive route first, and if that fails, they will send them to us.
Wow. Well, if we look at the video again, I want to see people, I want to see that patient again go through it. It's quite a compression. I mean, does it hurt?
It's mostly described as uncomfortable. I wouldn't say painful. The first week, patients, we have very good therapists, and they talk the patients through the first week. And after that, they just become accustomed to it and fall asleep, watch television, listen to the radio. So I would say it's very well tolerated.
And how many minutes is a one treatment?
The therapy itself is 1 hour a day.
Okay,
and
1 hour a day.
For 5 days a week, and they come 35 treatments.
So it looks like it's on at least as tight as a blood pressure cuff.
Yeah, it pumps up to 300 millimeters of mercury, which is a little bit stronger than a blood pressure cuff, but it only squeezes for a millisecond. So it's not like
Right.
it's squeezing and holding. It squeezes and releases with every heartbeat.
Wow, and what kind of response have you had from the patients who have taken this therapy?
Incredible. Patients are ecstatic. They can't say enough about the treatment. I've had patients come up and just give me a hug and say, thank you so much for bringing this to Buffalo. I mean, you gave me my life back. It's probably the most common thing I've heard over the last 8 years of doing the therapy.
That's great. Aaron, is this covered in any way by insurance?
Actually, all insurances, Medicare,
that's fabulous.
Medicare, Independent Health, Univera, Blue Cross, all your insurances cover the treatment for appropriate candidates.
Does your doctor have to recommend this for you, or can a patient call you?
A patient actually can call direct, but we do work very closely with their doctor.
Certainly.
We always want to keep
Makes
their
sense.
prescriber in the loop. So if a patient calls us direct, we always copy their cardiologist and primary doctor of what the patient's intentions are.
Certainly, so they have an idea. They know what's
Right.
going on.
We want to partner with their physician, so it's a consortium of care.
Well, let's put up the information, everyone, because if this sounds like a great treatment for you or someone you know and love, want to talk to the doctor about it, you want to give them a call yourself, VascuFlo Incorporated is now here in Buffalo. In fact, they have locations in Cheektowaga, West Amherst, Niagara Falls, and Irving, New York. So for more information, here's the number you're looking for. It's 681-2968. That's 681-2968. Or you can simply dial up the website at www.vascuflow.com. Aaron, thanks for such a great story. Our best to your dad as well.
Thank you very much.
Okay, everybody, we'll take a quick break and be right back. This preceding segment and video use provided by VascuFlo Incorporated and Vaso Medical Incorporated.
The preceding segment was sponsored. Portions of the AM Buffalo and Buffalo Weekend programs are sponsored. The opinions expressed do not necessarily reflect those of WKBW-TV or the host.
More and more Western New Yorkers are watching Eyewitness